Greetings, everyone. Today, I am going to talk about opportunities for addressing immunization disparities in medical professionals training. The presenters are Drs. Ramesh, Reuben, Radix, Holder, Brown, Cooper, Offodile, Juarez, and Matthews-Juarez. We belong to the National Center for Medical Education Development and Research at Meharry Medical College. This center was created 6 years ago to focus on the healthcare needs of vulnerable populations, specifically LGBTQ people, persons experiencing homelessness, and migrant farm workers, with the objective of translating, developing, and disseminating our research on these populations, specifically pertaining to the status of educational interventions using research, curriculum modules, and policy briefs with the help of communities of practice that we have established. Our leadership team consists of Dr. Irene Sanwall, Project Director at Project Officer at HRSA, Dr. Patricia Matthews-Juarez, the Principal Investigator, Dr. Paul Juarez, the NCM Media Director, Dr. Catherine Y. Brown, Director Communities of Practice and Dissemination, and myself as a Director of Research. And coming to the policy brief, who are the stakeholders? They are curriculum planners in medical and allied health profession schools, education policy makers in government, legislature, and advisory bodies, including federal agencies, professional associations, and non-profit organizations. In terms of relevance, this policy has a great deal of relevance as immunization disparities have not received adequate attention either in medical education or residency training. This lack of training is more pronounced when vulnerable populations such as gender and sexual minorities, people experiencing homelessness, and migrant farm workers are considered. As a result, we have an ill-prepared workforce that will not be able to provide culturally responsive and appropriate care for these populations. Therefore, curricular interventions are expected to result in perceived and quantifiable improvements in patient care for vulnerable populations. So what are the options before us in terms of policy? Existing information on immunization disparity training should be considered and evaluated before proposing any new curricular interventions and accepting them. Towards this end, we need to have a multidisciplinary engagement of stakeholders, including general public, consumer groups, advocacy groups, to develop a mutually agreed upon training objectives before we make policy for this. And for any additional information, our presence is there on social media handles. You can reach us anytime if you need any additional information. Thank you.